Hello, listeners. A warm welcome to Views on Health. A great pleasure, as always, to have with me on the program a medical consultant, a specialist in a particular field of discipline. And today it's Dr. Kishara Gunaratne, consultant neurologist, senior lecturer, Faculty of Medicine, University of Moratuwa. And as a consultant neurologist, the focus tonight is on migraine, a very common problem amongst people in Sri Lanka. Without any further ado, may I ask you to please explain to us about migraine? How does it happen?
Pleasure to be on the program. So migraine is one of the most common types of headache. So it's a headache, and it's one of the commonest causes for headache worldwide. And so if you see, say, 10 or 20 patients with headache, 8 out of the 10 that we generally see as an outpatient would be, their cause would be migraine. So it's that common, and it's a type of headache, and it can really affect the quality of life of the person who suffers from migraine. So it's quite a variation in how they present. For example, some people might experience migraines maybe once or twice a year, as opposed to some having headaches on a daily basis, and really affecting their quality of life and affecting every aspects of their life, including their life at home as well as their life at work. So it's a common ailment which needs to be addressed.
Does it affect everybody? I know, does it start with children, and then does it proceed throughout life, or would somebody be just okay for years to come, 20s, 30s, and then suddenly the headache might be that bad that a doctor might say you got a migraine?
So it's definitely common among females or women, and it's often during the reproductive age group, say from 18 to 50 or 45, and that's where migraine is the most commonest or the most frequent. And I would say, so teen years in a woman would be when it typically starts, and then as they age, maybe towards menopause, the frequency does reduce in a certain proportion of patients, where once they attain menopause, we see that there is a reduction in the frequency. But I would say a good 2/3 to 1/3, there is no reduction in frequency even after menopause. So you can have migraines throughout life, but it's common in the reproductive age group.
And so if females are more affected than men?
Yes.
Males. Having said that, doctor, so you said now it's an extension of a headache. It starts off as a headache and then it turns out to be a migraine. But how does one detect what's the difference?
So the headache is a symptom. So there's a constellation of symptoms. So the headache is generally what we describe as moderate to severe. So it's severe enough to affect the quality of life of that particular person. It can last from a few hours, maybe 3 to 4 hours, to sometimes 2 to 3 days. It's quite a range of how long it would affect the patient. So the qualities, it can be what we generally describe as pulsatile. And it can be associated with symptoms such as vomiting, nausea and vomiting, and also the patients who suffer from these headaches or migraines might have light sensitivity. They might be very sensitive to light, and also they might have sensitivity to sound as well. So all these constellation of symptoms would generally describe a migraine. And if you actually, there is no particular cause. So, say for example, and if we perform an MRI or image the brain, we don't find any abnormality in the brain. So these are what we call as primary headaches, where we don't find a cause for these headaches. Of course, there are many triggers for these headaches, and it can range from various food products, for example, cashew, cheese, chocolate, wine. So the finer things in life, as it were, can trigger off migraines. Stress, very, very common trigger for migraines. So when the levels of stress go up, the frequency of migraines do increase. The other triggers can be, for example, the menstrual cycle. Sometimes the migraines tend to sort of increase in frequency in and around the period. The other, some of the triggers could range from, say, very strong smells can sometimes trigger migraines in certain people. So it's quite a variety of triggers that can often trigger migraines.
So, doctor, normally when one gets a headache, one takes a paracetamol, and hopefully it settles.
Yes.
After a period of time. Now, in this instance, I might assume that if one does take a paracetamol, or two, I mean, when I say paracetamol, whatever the dosage is, according to one's age and how much one has to take, would it, and it doesn't subside, and it continues, then would you say that the person should take another dose of paracetamol, say like every 6 hours? And still if it doesn't, then obviously there's something more to it. So then, could then one assume, I think I have a migraine?
Well, migraines do respond to paracetamol. It's a stepwise kind of treatment that we generally do, but again, it depends on the nature of the migraine. So in certain instances, paracetamol does work, and we always advocate taking paracetamol because that is the least, in the sense, it's commonly available, it's over the counter, and it very, very rarely does cause side effects, and a lot of people are used to taking paracetamol, and if paracetamol really works, then we always advocate, please do take paracetamol. The message here is to take the paracetamol as soon as you perceive the headache. And often what people do is, especially migraineurs or people suffering from migraine, what they do is they take the paracetamol when the headache is at its worst. So in migraine, the onset is very gradual. It starts off with a very mild headache, and then as time goes by, there is a slow increase in the intensity of the headache, and then it goes to a peak, and then there's a natural reduction in the intensity with time. So, and that can range from, say, as I said, 3 to 4 hours, lasting up to even 3 days, and in certain people, even sometimes weeks. So it depends on the type of migraine. There are many types of migraine. So the message here is to do you take a painkiller. Paracetamol is the commonest and the most widely available, but take it as soon as you perceive. So the general recommendation is to take paracetamol within 20 minutes from the onset. Of course, if in certain people paracetamol does not really work, then what we do is we advocate certain other types of painkillers, but that again to be taken as soon as the person perceives the headache. That's of course the treatment for the migraine itself. But when migraines become problematic, when they are too frequent, affecting the quality of life of the person who suffers from migraine, then it's time to actually meet a clinician or a doctor who specializes in the treatment for migraine, of migraine. And then in those particular people, I think they need to be on long-term medication, at least for a few months, to prevent the number of, or to reduce the number of attacks that they would have over a period of time.
Being in the sun, people, those who do outdoor activities, would that trigger?
Yes, it's a very, very common trigger, especially in Sri Lanka, because it's a tropical country, and a lot of people are indeed outdoors. And it is indeed a very common trigger. And what I often advise my patients would be to actually use shaded glasses or sunglasses or any eyewear that actually shields you from the sun, and to actually wear it before they actually get out of the house. And also maybe a broad brimmed hat would also save you from the sun. So those are things. So certain things, changing your lifestyle accordingly also helps in reducing the frequency of attacks that one would have. Say, for example, the food products I gave, the examples of various food products. So avoidance of these particular triggers can actually help in reducing the attacks. And also lifestyle itself. Often what we say is, please do lead a healthy lifestyle. A balanced diet often helps. Taking meals on time often helps, because even hunger for certain people actually triggers migraines. So you need to take meals at an interval that makes sense and that you are used to. So make sure that you're always having a meal on time. Adequate sleep. Too much sleep always triggers migraines, and as well as little sleep. So you need to plan your life. And what I've noticed throughout the years is that it's a balance, or what we call equilibrium. So basically, if you lose balance, then you're more likely to have migraines. And migraineurs are very sensitive to the environment changes in say, for example, temperature. Certain patients that I come across who live in, say, the central part of Sri Lanka, up in the hills, when they come down to Colombo with the heat, they get migraines, and vice versa. Some people who live in say in the coastal belt, and they go to say the hills, because of the drop in temperature, they get migraines. So it's so again, triggers can be varied, can be very individualized, in the sense certain triggers for a certain person might not be the same triggers for another person. And I think managing your life and lifestyle, identifying the triggers and changing your lifestyle accordingly also helps in treating this particular disease or disorder.
So what is the treatment? You obviously have to give them some sort of medication to help them to overcome the condition. And then, as you said, sometimes it can go for a couple of months, and then there's one stop. And also, doctor, along with that, I'd like to know, in the interest of our listeners, whether it can lead to something more in terms of something in the brain, something anywhere in the body, because it's connected, and will the headache lead to something else?
So with regards to treatment, treatment is twofold. One is to treat the migraine itself, and that's mainly prescribing painkillers, of which paracetamol is the most common drug that we would generally advocate if that works. But there are other types of drugs when they fail, that we use to treat the migraine itself, and also drugs to prevent the future attacks of migraine, which is called prophylaxis treatment. And those are the groups of drugs that you need to take every day. And again, it's very individualized. Say a certain drug for a certain person might not be helpful for another. So it's a very individual based selection of what we use as drugs to prevent the number of attacks per day. With regards to whether migraines actually lead to a more sinister disorder or disease that can really affect the quality of life as well as mortality and morbidity of that particular person. In the majority of cases, it does not. Of course, there are certain types of migraine which is associated with what we call an aura. For example, there's often in about 15% of patients with migraine, they have what's called a warning or an aura, where and the commonest ones are basically they often see various lines, flashes of light before they actually and that goes on for a few minutes, and then they really experience the migraine or the headache. Some people get this tingling sensation over their body, and then that progresses into a very severe migraine. In those people, especially if they're using the oral contraceptive pill, they are at a slightly higher risk of developing stroke subsequently, and we need to basically counsel patients who are actually on the oral contraceptive pill who've got this aura or migraine with aura. So there are various types of migraines. Those particular patients may be at a slightly higher risk of developing stroke in the future. So I think that answers your question. But in the majority, 99% of migraineurs or patients with migraine, it will be often a benign course, and that's why we call these patients as having primary headaches, because those headaches are really benign.
Apart from any problems connected to one's head, could it trigger any other kind of reaction? You did say that they can be nauseous, they can be vomiting, and some of those conditions. But would it affect any other part of the body? Is there any connection?
The symptoms can they may have a multitude of symptoms. They might have low mood associated with migraine. They may be easily fatigued. Some people they have an increased appetite. They start yawning. So the symptoms often are not pleasant, and that's why it's not only the headache. It affects the whole body with regards to symptoms. And that's why it affects quality of life, in the sense I've had so many patients coming in saying that if they're schooling, they're losing so much of school hours because of migraines. And often during exams, say for example O levels, advanced levels, during the exam season, as it were, we get a number of patients coming in before the exams, and often people class them as, oh, she's under stress, but it's the stress that's true, but it's the stress that actually triggers the migraines, and we need to really address treating those patients with migraine. With regards, so in those particular patients, it's the stress that actually triggers migraine.
Doctor, you said it's associated more with females and in the reproductive age, and but does it mean that children won't get an attack?
No, they do get, but it's not as common as it were in say teenage age group. But yes, and it can present in different ways. For example, they might have the headache may not be as prominent. They may have a little bit of pain in the tummy or abdominal pain that can present as migraines. But that again is very episodic in the sense it comes on for one day or two and then disappears, it comes on again. Again, kids do get it. Again, the typical headache with the light sensitivity, the sound sensitivity, and they may have a little bit of what we call vertigo, where they feel dizzy and which is also again associated with headache. So the symptoms might be a little different from the typical migraine symptoms that an adult would experience.
But end of the day, you, as you explained, there'll be more girls affected than boys.
Yes, girls are definitely affected. Not so much in childhood, but as soon as the cycle starts, it's the hormones have an effect on migraine.
So you gave us a certain sort of reasons. You explained why there be an onset of the headache that can lead to the migraine. But would something like even not having meals on time and lack of sleep are all contributory factors? Having said all of that, would you say that now if you take a child would actually have stress in that sense, but it can still trigger?
Yes, again, stress in the sense, stress to a child might be different from stress in an adult, but it is still indeed a trigger. Secondly, can be again meal time, hunger, not taking meals on time can also be a trigger. So again, triggers might be different, but the migraine is the same.
Thank you, Doctor. It's been very interesting listening to all of this and getting a clear picture on how the attack gets, triggered, and then how one has to cope with it. What advice would you give a patient who has this condition, but should he or she do, she more than the he, according to your explanation, to overcome? Because if you get such a severe headache, obviously you can't go. It will affect quality of life. Maybe one can't go to school and do work. One can't go to office, or even somebody's in the house. End of the day, same situation. So what should they do to help themselves recover sooner, along with whatever medication they may take?
Yeah. So there is the first thing is there's no complete cure for migraine. And basically there's no so it's basically treatment. If the attacks affect quality of life of the person, you need to get some advice and medication from a medical practitioner. That's number one. Number two is lifestyle. You need to identify the triggers that trigger your migraine, and then change your lifestyle accordingly. And I think that is the biggest message that I would like to share with our listeners.
So would that be a take-home message?
That would be a take-home message, yes.
Thank you so much, Doctor. It's been interesting. And I sincerely hope our listeners will benefit by the explanations given by Dr. Kishara Gunaratne, consultant neurologist and senior lecturer at the Faculty of Medicine, University of Moratuwa, on this very interesting topic, migraine. And I hope that should you have a problem, you'll certainly follow the good advice given by Dr. Kishara Gunaratne. Thank you so much, Doctor.
Thank you.
My thanks also go to Manjula Seniviratne for technical assistance. I'm Fatima Razikada saying good night and hoping to be with you next Monday, same time on Views on Health.